Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, we have a question from our Facebook audience this week. The question is, what procedure should you get or should they get for a flat stomach and to enhance their waistline? And a little bit of a little history on this is that they're 52 years old. They've had two C-sections, one in 1992 and one in 1996. They've had liposuction, and that was done recently in June of 2015. They're not happy with the results. They ended up with an uneven stomach and lump in the stomach on the left side. So a couple of issues here, and they're looking for the best advice to go forward. Dr. Pane, what would you recommend in this situation?
Well, what we're talking about here, and I did see the pictures, the skin actually isn't real loose, but again, at 52 years, there is going to be less elasticity or tightness of the abdomen than at a younger age. Also, given the history of two C-sections, that means that there's been a couple of pregnancies, of course, and that there's a scar at the lower abdomen, so some of that skin is going to be hanging down. So the liposuction, not a real flat belly, what liposuction should have been described as before it had been done is that it will reduce the pinchable fat, and it can make you feel less thick in clothes, but it doesn't usually make the abdomen look great, depending on how well the skin shrinks down, especially when you get into the looser skinned situation in a few years past, say 35, 40, something like that. So in this case, it's possible, because the skin isn't real bad, additional lipo could be done to smooth out some of those spot areas. That is one option. The other one, probably the better option if you want to get the abdomen flatter, is to convert to a full abdominoplasty. It's been a year, so it's fine to go ahead and do that. And you can tighten the muscles on the inside. You can do a little liposuction around the waist to contour it better. It does involve a scar, but with C-section scar, you've got a scar that's most of the way there anyway. So for a little bit of an additional length of scar, you can get a bigger improvement to the abdomen. So that's what I would favor as the number one answer here, with lipo as a fallback option only in that special situation where procedure.
Well, thank you, Dr. Pane. We appreciate your time. And if you have a question for Dr. Pane, please visit our website or Facebook page. And thank you, Dr. Pane, and we'll see you next week on the next question.
Great.